Can I ask you something personal? When was the last time you experienced complete quiet and actually noticed it? No ringing, no buzzing, no hissing, and no persistent high-pitched tone following you from the moment you wake up until you finally fall asleep. If that kind of silence feels like a distant memory, stay with me, because today we're going to look at something that affects millions of adults over 60 and yet is still widely misunderstood. I'm Dr. Andrew Parker, and we're talking about tinnitus, that persistent ringing, buzzing, humming, or hissing sound that seems to come from inside your ears, even when there is no outside source creating it. And if you've ever been told it's just part of getting older, you'll have to live with it, I want you to know that answer may be far too simple. Tinnitus is real. It can interfere with sleep, concentration, mood, and your overall quality of life. And while there is no single food, vitamin, or lifestyle change that can guarantee the ringing will disappear, there are several important areas worth looking at. Before we continue, tell me in the comments, how long have you been dealing with tinnitus? Has it been a few months, several years, or even longer? Your experiences help this community understand what people are actually going through. If you enjoy practical, evidence-informed health advice for healthy aging, consider subscribing to Vital Health Insights. It only takes a second, and it helps us keep bringing you useful information. Now, let's start with something that may surprise you. Many people assume tinnitus is simply a problem with the ears, and that makes sense because that's where the sound seems to come from. But tinnitus can also involve the way the brain processes sound. Think about a smoke alarm in your home. Imagine that alarm begins making a strange beeping noise even though there is no smoke and no fire. The alarm is producing a signal even though there is no outside danger for it to detect. Something somewhat similar can happen within the auditory system. Changes involving the inner ear and the brain's sound processing pathways can cause the nervous system to generate or amplify the perception of sound, even when there is no external noise creating it. This is one reason tinnitus can be difficult to understand and manage. I once worked with a patient named Margaret, a 67-year-old retired teacher from Ohio. She had been dealing with a high-pitched ringing in both ears for about 3 years. She had already seen 2 ear specialists and undergone a hearing evaluation. She was told that her hearing was within the expected range for her age and was given information about sound machines. But Margaret was struggling. She wasn't sleeping well. She couldn't concentrate on reading the way she used to, and she was becoming increasingly anxious about the constant noise. She told me, "Dr. Parker, sometimes I feel like I'm losing my mind." My response was simple. What you're experiencing is real, and it deserves to be taken seriously. That doesn't mean there is one hidden cure waiting to be discovered. It means there are several factors worth evaluating. Today, we're going to look at nutrition, circulation, nerve health, stress, sleep, medications, hydration, and everyday habits that may influence how some people experience tinnitus. Let's begin with a mineral that doesn't get nearly enough attention when people talk about hearing health: zinc. Your inner ear contains zinc, and this mineral plays important roles throughout the body, including normal cellular and neurological function. Deep inside the ear is the cochlea, a small spiral-shaped structure responsible for converting sound vibrations into signals that can be interpreted by the brain. Inside the cochlea are delicate sensory hair cells. These cells are essential for hearing, but they can be vulnerable to age-related changes, loud noise, and oxidative stress. Zinc is involved in numerous cellular processes and in the body's antioxidant defenses, which is one reason researchers have investigated its possible relationship with hearing and tinnitus. Some studies have reported lower zinc levels in certain people with tinnitus. However, that does not prove that zinc deficiency causes tinnitus, and it does not mean that taking extra zinc will eliminate the ringing. That distinction is important. If you want to support your zinc intake through food, consider pumpkin seeds, lean red meat, chickpeas, cashews, and oysters if you enjoy them. These foods can fit naturally into a balanced diet. Rather than automatically reaching for a high-dose supplement, look at your overall eating pattern and ask your healthcare professional whether testing or supplementation makes sense for you. Now, let's move to another factor that many people notice almost immediately: stress. Have you ever noticed that your tinnitus seems louder when you're exhausted, worried, or under pressure? You're not imagining that connection. Stress can change the way your nervous system processes sensory information. When your body remains in a heightened state of alertness, the brain can become more sensitive to internal signals, including tinnitus. One neurotransmitter involved in nervous system activity is glutamate. It helps nerve cells communicate and plays an important role in normal brain function. The auditory system needs a balance between excitatory and inhibitory signals. Magnesium participates in many processes throughout the nervous system, which is one reason researchers have investigated whether adequate magnesium status may play a role in auditory health. Magnesium inadequacy can occur when diets are consistently low in nutrient-dense foods. Good food sources include spinach, Swiss chard, avocados, almonds, black beans, and modest portions of dark chocolate. Research into magnesium and tinnitus is still developing, so I would not describe magnesium as a proven tinnitus treatment. But making sure you get enough magnesium through a balanced diet is reasonable for overall health. And if you are considering a supplement, especially if you have kidney disease or take several medications, discuss it with your healthcare professional first. Now, let's talk about vitamin B12, because this becomes particularly important as we get older. Your nervous system depends heavily on B12. It is involved in normal nerve function, red blood cell production, and DNA synthesis. As we age, changes in stomach function and digestion can make it harder for some people to absorb B12 from food efficiently. Certain medications and medical conditions can also interfere with absorption. B12 is essential for maintaining healthy nerves and producing myelin, the protective covering surrounding many nerve fibers. Think of myelin like the insulation around an electrical wire. When that insulation is damaged, electrical signals may not travel normally. The auditory nerve is part of this nervous system, which is one reason researchers have investigated connections between B12 deficiency, neurological symptoms, hearing changes, and tinnitus. If you're experiencing tinnitus along with numbness, tingling, balance problems, unusual fatigue, memory changes, or other neurological symptoms, B12 status is worth discussing with your healthcare professional. And don't assume that a single number automatically tells the entire story. Your clinician can interpret your B12 result alongside your symptoms, medical history, medications, and other relevant tests. Margaret's situation was interesting for this reason. Her B12 result wasn't technically outside her laboratory's normal range, but it was toward the lower end. With guidance from her healthcare team, she addressed her nutritional status and other factors. Over the following weeks, she reported that her tinnitus seemed less noticeable. I cannot promise that same outcome for everyone. Tinnitus has many possible causes, and what helps one person may not help another. But her experience is a useful reminder that sometimes the basics deserve a closer look. If this information is helping you connect the dots, take a moment to tap the like button. It helps this video reach other people who may be struggling with the same problem. Next, let's talk about something that is easy to overlook: circulation. The structures of the inner ear depend on a delicate blood supply. Like every other tissue in your body, they need oxygen and nutrients delivered through the bloodstream. When circulation is compromised, the tissues involved in hearing may not function as efficiently. And one simple factor that can influence how you feel from day to day is hydration. As we get older, our sensation of thirst can become less reliable. Some older adults therefore go much of the day without drinking enough, simply because they don't feel especially thirsty. Unless your healthcare provider has given you specific fluid restrictions, make a habit of drinking fluids regularly throughout the day. Urine that is consistently dark can sometimes be a sign that you need more fluids, although urine color is also affected by medications, supplements, and other factors. Beyond hydration, your overall cardiovascular health matters. Foods containing omega-3 fatty acids such as salmon, sardines, and mackerel can be part of a heart-healthy eating pattern. Ginger, garlic, vegetables, fruits, whole grains, and other minimally processed foods can also contribute to a diet that supports cardiovascular health. But remember, these foods are not magic cures for tinnitus. They are pieces of a larger strategy for supporting your overall health. Now I want to give you an important warning about something that may already be sitting in your medicine cabinet. Some medications and substances are considered potentially ototoxic, meaning they can affect the auditory system in certain circumstances. Certain commonly used pain relievers, particularly when taken frequently or at high doses, have been associated with tinnitus or changes in hearing in some people. This can include some non-steroidal anti-inflammatory drugs used for arthritis, headaches, and other types of pain. But please hear me clearly. And I'm not telling you to stop taking a medication that has been prescribed or recommended for you. Never discontinue an important medication simply because you heard it might be connected with tinnitus. Instead, if you've noticed that your ringing started or became worse after beginning a medication, tell your healthcare professional. They can review the timing, dose, other medications, and your health history to determine whether the connection is meaningful and whether another option is appropriate. That conversation can uncover a possible connection that otherwise might have been missed. Let's also talk about vitamin D. Most people know vitamin D for its role in maintaining strong bones, but it participates in a wide range of biological processes, including functions involving the nervous system. Researchers have investigated vitamin D levels in people with tinnitus, and some studies have reported an association between lower vitamin D levels and tinnitus. An association, however, does not automatically mean that vitamin D deficiency causes tinnitus. If you're concerned about your vitamin D status, your healthcare professional can determine whether testing makes sense for you. Appropriate sunlight exposure when possible, along with foods such as salmon, eggs, and fortified dairy products, can contribute to your vitamin D intake. If supplementation is necessary, the appropriate amount should be based on your individual needs rather than guesswork. Now, here's another connection I don't want you to overlook: sleep. Tinnitus and poor sleep can create a frustrating cycle. When you're exhausted, your nervous system can become more sensitive to internal sensations. That can make the ringing seem louder or more intrusive. Then the ringing makes it harder to sleep. Poor sleep makes the tinnitus harder to tolerate, and the cycle starts again. If you've experienced this, you know how exhausting it can become. That's why improving your sleep isn't simply about feeling more rested. Better sleep can also help you cope with tinnitus more effectively. Try keeping a consistent sleep and wake schedule. Make your bedroom cool, comfortable, and as dark as practical. Reduce screen exposure before bed if you find it stimulating. Give yourself a predictable wind-down routine. Some people also find gentle background sound helpful at night. That might be quiet music, a fan, nature sounds, or another neutral sound that prevents the room from feeling completely silent. The goal isn't necessarily to drown out the tinnitus. It is to give your brain another, more comfortable sound to focus on. Now, let me give you a simple action plan you can begin with. First, take a look at your meals. Instead of searching for one miracle food, build meals around nutrient-dense choices. For example, you might have salmon or sardines for omega-3 fats and other nutrients, leafy greens for magnesium, and pumpkin seeds for zinc. Use foods such as garlic, ginger, vegetables, fruit, whole grains, and healthy fats to create a balanced eating pattern. Second, talk with your healthcare professional about whether checking B12, vitamin D, or other nutritional markers makes sense for you, particularly if you have risk factors for deficiency. Third, review your medications. If you regularly use pain relievers or other medications and your tinnitus has changed, make sure your healthcare provider knows about the timing. Fourth, pay attention to hydration throughout the day rather than waiting until you feel extremely thirsty. Fifth, protect your hearing. This is one of the most important habits for long-term auditory health. Repeated exposure to loud music, machinery, power tools, or other intense sounds can damage delicate structures involved in hearing. Use appropriate hearing protection when you're around sustained or dangerously loud noise. And don't wait until your hearing has noticeably declined before you start protecting it. There is one more point I want you to remember. Persistent tinnitus deserves an evaluation, especially when it is new or changing. If the ringing is only in one ear, pulses with your heartbeat, appears suddenly, comes with sudden hearing loss, severe dizziness, weakness, or other neurological symptoms, don't simply assume it is ordinary tinnitus. Those situations deserve prompt medical attention. For many people, a hearing evaluation is an important starting point. Depending on the findings, a clinician may look for hearing loss, earwax blockage, medication effects, blood pressure issues, metabolic conditions, or other possible contributors. And sometimes treatment focuses not on eliminating the sound completely, but on reducing how intrusive it feels. Hearing aids, sound therapy, counseling approaches, and other evidence-based strategies can help some people manage tinnitus more effectively. There is also an important difference between managing tinnitus and searching for a guaranteed cure. I want you to keep that distinction in mind because it can protect you from expensive products and unrealistic promises. You may see advertisements claiming that one special supplement can remove tinnitus permanently, or that a particular food will rebuild damaged hearing overnight. Be careful with those promises. Tinnitus can have many different causes, and there is no universal treatment that works for everyone. A better approach is to ask a few practical questions. Did the tinnitus begin suddenly or gradually? Is it present all the time, or does it come and go? Is it affecting one ear or both? Does it seem synchronized with your heartbeat? Did it begin after a new medication, an illness, an unusually loud noise, or a change in your hearing? Those details matter. If you notice that the ringing is strongest after a stressful day, that is useful information. If it becomes more noticeable after poor sleep, write that down. If you notice a change after spending several hours around loud machinery, mention that too. Keeping a simple symptom diary for 2 or 3 weeks can sometimes reveal patterns that are difficult to remember during a short medical appointment. Write down when the tinnitus is strongest, how well you slept, your stress level, any unusually loud sound exposure, and any medications or supplements you took. You don't need a complicated spreadsheet. A few notes on your phone or a small notebook are enough. Another helpful step is to have your hearing checked if you haven't done so recently. Hearing loss and tinnitus frequently occur together, and many people don't realize how much hearing they have gradually lost because the change happens so slowly. When hearing becomes weaker, the brain receives less sound information from the environment. For some people, that altered input may contribute to tinnitus becoming more noticeable. If hearing loss is present, hearing aids may help some people by making everyday sounds clearer and reducing the contrast between environmental sounds and the tinnitus. That doesn't mean hearing aids are a cure, but for the right person, improving access to external sound can make the internal ringing less dominant. You can also think about your environment at night. A completely silent bedroom is not always ideal for someone with tinnitus. Silence can make the internal sound feel much louder. A quiet fan, gentle rainfall recording, soft instrumental music, or another low-level background sound can provide a more comfortable auditory environment. Keep the volume low enough that it doesn't become another source of noise exposure. And if tinnitus is making you anxious, remember that the emotional response can influence how intrusive the sound feels. The more frightened and focused you become, the more attention your brain may give the sensation. That doesn't mean the sound is imaginary. It means attention and emotion are part of the brain's processing system. This is why approaches that help reduce anxiety, improve sleep, and change your response to the sound can help even when the tinnitus does not disappear completely. I want to come back to Margaret for a moment. Several weeks after working with her healthcare team on the different factors we discussed, she told me something I'll never forget. She said, "It's quieter. It's not gone, but it's quieter." She was sleeping better, feeling less anxious, and finding it easier to concentrate. Again, her experience doesn't mean everyone with tinnitus will have the same result, but it illustrates something important. You don't have to ignore persistent symptoms and assume nothing can be done. Tinnitus can affect your sleep, concentration, mood, relationships, and sense of peace. Because it can have different causes, it deserves an individual evaluation rather than a one-size-fits-all answer. So, tell me in the comments, which part of today's discussion stood out to you most? Was it B12, magnesium, hydration, medication review, sleep, hearing protection, or the importance of getting your hearing evaluated? I'd genuinely like to know what you've experienced. And if someone you love has been quietly struggling with ringing in their ears, consider sharing this video with them. Sometimes simply understanding that tinnitus is a real neurological and auditory experience can be reassuring. Most importantly, don't blame yourself. You did not choose to have tinnitus, and you don't have to feel embarrassed about talking about it. Keep track of when the sound seems stronger or weaker. Notice whether stress, poor sleep, loud environments, or certain medications seem to affect it. Bring those observations to your healthcare professional. Those details can make your evaluation more useful. And remember, this video is for general educational information. It is not a diagnosis or a substitute for personalized medical care. Speak with your own healthcare professional before changing medications, starting supplements, or making significant changes to your treatment. If this video helped you understand tinnitus a little better, please give it a like, subscribe to Vital Health Insights, and share it with someone who may be struggling with persistent ringing in their ears. I'm Dr. Andrew Parker, and thank you for watching Vital Health Insights. Stay healthy, stay informed, and I'll see you in the next video.